Ashley with Amare. So, what a busy week. I'm just going to talk to you guys today. There's like the general broad topic for today is Miami. I mean, all the Miami stuff and the lymphatic drainage that goes on there, or what they call lymphatic drainage. First of all, let me start off by saying there is nothing wrong with getting surgery done in Miami. There's nothing wrong with getting surgery done anywhere, guys. Anywhere you go, your surgery is going to be fine as long as you like your surgeon. Number one. Number two, you're still going to have to do the aftercare. No matter what, you have to do the aftercare. That is your responsibility. So the first part of this topic is, why doesn't your doctor tell you about manual lymphatic drainage? Why does your doctor say not to get manual lymphatic drainage? Why does your doctor say lymph drainage is bad? Well, first of all, lymph drainage isn't bad. Let's get that straight. Second of all, they don't know what it is, so they don't really know at all how to tell you. Now, that's not to say all doctors do. There are a lot of doctors that know exactly what lymph drainage is and completely recommend it, like completely. So it really depends on your doctor. It really depends on what they believe. It really depends on your research. Now, aftercare is not your doctor's job. I have tons of videos talking about this, guys. Aftercare is not your doctor's job. Aftercare is your job. Figuring out your aftercare is your job, which is why we exist at Amare. So when it comes to why didn't my doctor tell me I needed all this stuff, why didn't my doctor tell me I needed all this lymph drainage? Well, you guys do the research on the surgeries. You guys follow the surgery pages. You guys are part of all of these surgery groups. You should kind of know. But why don't we have a standard for lymph drainage in this country? Because medical professionals don't think it's a real thing, because they can't charge for it, because not that they can't charge for it, but because it's not like regulated, because it's not a medical device, because it's not something like that. It's not like, something that they can do. So when it comes to how come my doctor doesn't tell me, well, what are they supposed to tell you? Like, you have to do your research on your own. Well, that's the first thing. So doctors who do promote lymph drainage, though, like the doctors we work with, do believe in what we do. They do know that proper manual lymph drainage works. My cat is in the screen. They do know that proper manual lymph drainage works. They do know that everything that we do helps. They do believe in the post-surgery recovery aspects. Now, picking a doctor is like picking a tattoo artist. And I use this analogy all the time because, guys, getting a tattoo is like minor surgery. When you pick a doctor, going with a doctor that has good results is one thing, but going with a doctor who cares is another thing. So going with a doctor who has great results on Instagram and all of that is fine, but you have to do your research on the doctor. It's like anything else. You have to make sure that their office is good, their aftercare is good, because I cannot tell you, not just in Miami, but how many stories I hear in a week of, oh, well, they were great until they got my money and the surgery was done, and then that was it. I haven't heard from them since. Or I'll ask, are you going in for your follow-up? Like, when is your follow-up date? And they'll go, oh, well, I don't know. I haven't heard from them. I've got to call them again because they won't answer my calls now. So, yes, unfortunately, that does happen a lot in Miami. Places like New Life, places like Spectrum, places like Mia Aesthetics, all of these names where you have these doctors. It is not the doctor's job to check in on you after surgery. Yes, it is something that they do. Yes, it is kind of like, okay, they need to do a follow-up to make sure your incisions aren't infected. But again, another common thing that I see, a lot of doctors will look at you and you're super swollen and it's 2 months post-op and you're like really uncomfortable and you don't like the way you look and things aren't really, where you wanted them, and you've got like a lot of fibrosis, and they're like, oh, you look great. And you're like, what? You're like, I don't feel great. I've got fibrosis. I've got hard patches. My garment doesn't fit right. What do you mean? They're like, no, you look great. Well, what they mean when they say that is your surgery looks great. Your healing is your responsibility. So, yes, you don't look great because your skin has these little fibrotic lumps in it and it's hard and it's not the way that it should be. But when they say you look great, they're talking about the surgery. You look great. Your incisions look fine. Your all that stuff is fine. But does that mean that you're happy with where you're at? Does that mean that it's where it should be at that time period for your surgery, for your body? Not necessarily. But again, that's not really the doctor's job. That's not what they're looking for. They're not, meant to hold your hand through the whole thing. So that's one part of it. The other part of it is there are doctors that will hold your hand through the whole thing, that will, go the extra mile and tell you, hey, you need to go see Ashley and get your lymph drainage done. Hey, you need to make sure that, your garment fits right. Hey, you need to, do all of these extra things for recovery. There are some doctors that are great about that. But when we go to Miami, That is not always the case. That is often seldom the case, because they're not, you're paying a cheaper price because they're just doing the surgery. They're not worried about your care. They're not worried about your results like that. Your doctor probably won't even see you after the surgery. And if they do, it's very, very brief. And it's not to address a lot of your concerns. It's to make sure their work looks good. And that's it. Unfortunately, that is how a lot of it is. Now, the second part to all of this about the doctors, guys, please do your research on your doctors. Do you know how many doctors work out of Miami that are not FACS board certified? They are surgeons, but they're not board certified. There are so many of them doing these surgeries, doing these procedures. It's insane. And on top of that, there are some of them that are double board certified, which is a wonderful thing. Double board certified means that they're certified like here and in Brazil. So they have different techniques. Now, again, going to these countries is dangerous because of the aftercare, is dangerous because of the medical part, is not dangerous because of the surgery. If you find a doctor that you really love and he's out in DR and he does an amazing job, go there. But just know that when you come back, you have so much aftercare that you need done. You have to find a specialist. So, going back to the Miami thing, the third part of this, when we're talking about Miami recovery and Miami surgery, it's the same thing as going to DR or Colombia or all those places. Go there for the surgery, do your recovery at home. Do not do your recovery there. If you have to, you can. But I've heard way too many horror stories of recovery houses feeding you salt, not giving you proper food, not picking up your medications, squeezing you in fajas that are way too tight, charging you for things that you don't need to be charged for, doing that like squeeze thing where they cut open your incisions and rake through your body and squeeze the crap out of you and fluid comes out. Yeah, the lymphatico drainage or the drainage massage, they're not massage therapists. And if they are, they're violating their licensing because you're not allowed to do that as a massage therapist. If you are using a needle or a syringe, you have to be a nurse, and that's fine. If you're draining a seroma and you're a nurse, by all means, please go ahead. But if you're claiming to be a lymphatic drainage therapist and you are using a needle on someone, cutting them open, there are fluids leaking out of the body, that is beyond your scope of practice. That is outside of your licensing, and that is not something you are allowed to be doing. So recovery houses will have these people come in. There are tons of people that do it. Now, outside of licensing and practice, that is so painful, and it's so not healthy for your body. Your body needs those vital fluids to heal the tissue. You're taking them out. So you're causing instant fibrosis because you're taking out any of the vital fluids that your tissue needs for you to heal. So there's that whole thing. We have a million videos on that. Check them out. They're on the IGTV. They're on the YouTube. Tons of stuff about that. I'm constantly preaching about it. But beyond that, the recovery houses are not always moderated. I mean, you can go and find tons of horror stories. And you can go and find tons of great things about them. The same thing with doctors. You can find horror stories or you can find great things. It depends on who you talk to, depends on where they went, depends on what they were looking for. Everybody is different. Everybody needs something different. So again, guys, original point, do your research. And again, it is not your doctor's job to do the research for you. But the last point that I'm going to make, how do you know? How do you know the research you're doing is good? How do you know what it's supposed to be like when there's so much conflicting information? And this is the number one question I get asked in every session. Why do they still do this in Miami? Why are they still allowing people to squeeze the crap out of clients, to rake through their body, to have fluid coming out, to be violating their licensing, to have no post-op knowledge whatsoever, to be touching people's fat transfer, to do all these crazy things in Miami, DR, Puerto Rico, Colombia, all these places, Mexico, even here in New Jersey, we have people that do it. But as I've called these places myself, and I've investigated, and I've talked to the therapists myself as if I was a client going in to get this done. As I have found out, these people are coming from Colombia for 25 years. They're massage therapists, and they're doing this. And they have a massage therapy license in the state of New Jersey, and they're doing this, which is, again, beyond their scope of practice and outside of their licensing. So are they violating the law? Yes. Are they still promoting themselves? Yes. Why has nobody cracked down on this? Why does it still exist? Why is it still out there then? Why is there all this misinformation? Because nobody's really moderating it. Like I said in the beginning, nobody's really checking on it. I mean, I actually just posted an article on our Facebook group, and I'll try to post it in our stories today so that you guys can find it. And I'll save it somewhere so you can also see it again. But there's actually petitions going on in Florida for the board to start cracking down and enforcing the law that, like, hey, this is literally illegal. This is illegal. This is against the law. You are not allowed to be doing this to people. Like, you have to stop. So they're trying to crack down on it. there have been tons of people in Jersey that have been, you know, taken out of practice because of it. They continue to be taken out of practice because of it. But going back to the doctors, how come they don't know? How come they're not telling you? Well, because they're not trained to. That's not part of their training. Their training is to do the surgery. They're not trained, hey, after the surgery, make sure your clients get lymph drainage because here's the anatomy of the lymph system and here's why it works and here's why it's beneficial for your clients. They don't get any of that. They have no idea about any of it. So when I go and meet with doctors or when I tell them, hey, I do lymph drainage, I have literally had doctors message me and be angry at me. Like very angry because I'm not squeezing their clients, because there's no deep pressure, because there's no cutting of incisions, because there's no fluid leaking out of the body, claiming we're a lymphatic spa. No, but that just goes to show you, do you really want to be going with a doctor who's not going to be open to any kind of therapies to heal your body, or somebody who just wants to do the surgery and be like, done, bye? Like, I've met with Dr. Subio. I've met with his, like, people in his office before. We love Dr. Subio. I listened to Johnny Franco's podcast. He is amazing with the aftercare and making sure that everything is the way that it should be after surgery, minimizing the risk, minimizing the pain, minimizing the narcotics. And then I know some doctors that will pump you full of oxys and pump you full of perks and all kinds of drugs because they want you to be comfortable and they think it's in your best interest, but it's not going to help you as far as healing. And I've seen tons of clients recently too, and in the past, that will come in and be so drugged up they don't even remember coming in. They don't remember half the things I tell them in the session. And that's kind of scary. I mean, you're a week post-op and you're still that super drugged up. So again, why do they do that? Because they don't know. Because they're only taught certain things in school, guys. It's not their fault. Stop blaming your doctor. That is not, it's on you to get your research. If you're going to get a tattoo, you are going to get a tattoo. You are going to research people. You're going to look at the tattoo you want. You're going to see if they do lines, if they do shading, if like what kind of color they use. Do they, you know, have their own style of doing things? Are they an artist originally, or are they just somebody doing trace work? Like, there's all these things that go into it. Now, if you're getting a tattoo at a boardwalk by some Joe Schmo that you don't know at a booth, obviously you're not doing that. But you should really be taking your surgery a little more seriously than that. It's an expensive thing. And aftercare is just as expensive as the surgery. Now, aftercare is not $5,000. Let's just say that. The most that you guys will spend with us at Amare, even if you're doing virtuals with us online and we're doing a virtual consult and getting you set up with supplies and, you know, you're getting your massages somewhere else because you're in another state and I can guide you to someone who actually does true manual lymph drainage, it's nowhere near $5,000. It's maybe $1.5 grand, maybe $2 at most. But like I say, when the fluid is off of you, it's gone. You don't need any more lymph drainage. Once it's out of you, now your body just has to heal. So there's no reason, again, back to the Miami mentality. What is the reasoning behind getting 20 massages, 40 massages, 30 massages? Why? What? You had surgery. The cloth has been cut. What are you shaping? If you cut a piece of fabric and it's cut, you shouldn't have to pull it and stretch it and rip it then to try and sew it together to make a quilt. That's not how that works. Once you're cut, the end. That is the surgery. That is your shape. Now, how do you get to see that shape? How do you get those results? Well, getting the fluid off of you that's hiding the results, because the results are where your natural shape now is. Out here is where the fluid is. In here is where your results are. So why don't you look like this, and why do you look like this? Because you still have all this fluid. Because what they did in Miami is take out all of the nutrients from that fluid that was going to heal the tissue, and then your body just got it stuck there because they dehydrated it and they ripped out all the good stuff, and now your body's just holding on to this like fluid that's now hard and dehydrated. And some people like that. Cavitation, body contouring, wooden rollers, heat, vibrator thingies on your body, like all kinds of strange things they do that they claim is lymph drainage. The tape method. Please, let's just talk about the tape method real quick. Guys, the tape method is for loose skin. The tape method is for after you've had lipo, after you've healed, and you need to help the skin retract a little bit. That's after all the fluid is out of you. The tape method is not, let me tape around you 360 to make sure that your skin heals. That's not how that works, guys, at all. The tape method is useful. I can do the tape method. I do not really ever do the tape method or promote it. The reason being is when your skin is reattaching to the fascia and the tissue after lipo, you have all the space in between, and all of this in between here is fluid. What the tape method does is it pulls the skin so that it's up higher and it's not sagging. So when it heals up a little bit higher. So when we're talking about the tape method, what is taping 360 around the body going to do? Nothing. It's just going to hold your skin in like a barrel, and then it's going to cause fluid to pool above and below the tape. Because when you're healing, your body needs to heal. Your skin needs to heal, especially if you have Lipo 360, all the way around. So when you're doing something like the tape method, it should be very strategically done. The person should be certified in taping, either rock tape or muscle taping or something like that, and certified in post-op care, not just I do lymphatic drainage or I do drainage massage and I'm cutting you open and squeezing through you. First of all, guys, you've got blood all over you, blood all over the place. The therapist's hands, or they should be wearing gloves. I know some people who don't, which is freaking gross. But their hands and everything is covered in your fluids. And then you have an open incision, which was once closed, that now has to heal again. Guys, it doesn't make sense. Stop doing it. But again, you have no idea. You don't know what you don't know. And we totally understand that, which is why I take the time to educate you guys, which is why I tell you in the room, even when I get asked a million times a day, why do they still do this? Why did they tell me this is what I need to do? Because they want to make money, because they don't have to be certified to do what they're doing, because they don't know any better, because there's no one actually enforcing the law in Miami. That's why. I mean, I don't know what else to tell you guys, but again, it is your responsibility to figure out what is fact and what is fiction. It's your responsibility to figure out, is this good for my body? Is this the right choice? Is this what I should be doing for my surgery for recovery? So you will find that there are some people that do lymph drainage that is not real lymph drainage, but just because they're Colombian, just because they are in Miami, does not mean that it's okay. Guys, just Google deaths of plastic surgery in Miami, and you'll find a bunch of them that come from their lymphatic massages, that come from their recovery house. Because when you're putting pressure on the body like that, where you're pushing fluid out of an incision, you're raking through someone who just had surgery, that barrier of fat and tissue that usually protects your organs is not there because they sucked it out. Yes, you still got muscle. Yes, you've still got tissue there, but it's not anywhere near as much. And there have been people that have died because of organ failure because they're squeezing the crap out of their stomach. This stuff is not just like a little thing, and you're paying them for it, which is beyond me, which is out of everything, like the craziest thing. Now, it's not just Miami. It happens here in New York. It happens here in New Jersey. It happens everywhere. But again, the biggest question I get asked, why does it keep happening? Because people don't know. They don't know any better. Because this is what they think needs to happen. Because this is what's been happening for years. And I'm going to leave you off with this note that I heard the other day, that someone said, just because we've been doing it forever doesn't mean that it's right. Just because that we've been doing it forever doesn't mean that it's healthy. Just because we've been doing it forever doesn't mean that it's safe. The point of the population advancing and the point of us discovering in science and all of these things, technology, innovation, everything, is to get better. So just because it's been done a certain way for years, however many years, does not mean that it is the right way. There is a better way. There's a safer way. There's a healthier way. There's a less painful way to do all of this. So again, I urge you guys, do your research. I hope this helped on some level. I hope I wasn't just ranting. But I literally this week have seen some crazy-ish, and I just needed to reinforce this. So again, the biggest thing is like, why don't doctors tell you? Why do they still do this in Miami? Why? And I think the thing that our clients get most frustrated about is, it's why did I do my research and still find these wrong answers? Because you're doing research in the wrong places. Stop watching the YouTube people who come from Miami that are not doctors, not surgeons, not post-op care people, not patient coordinators, not a professional at all. Stop. Just because someone had an experience does not mean it's the right experience. Does not mean that it's a healthy experience. Does not mean that it's a medically correct experience. They just had an experience. Yes, they may be happy with the way their body turned out, but that's them and not you. Just because they didn't get, fibrosis or something like that doesn't mean you're not going to by using the same methods. So again, guys, please do your research for yourself. Think a little bit. Think about your body. Think about where you're getting your information from. Consider the source. Consider the source. And just remember, just because we've been doing it for years does not mean it's correct. And it's never been correct for years. I mean, lymphatic drainage has originated in Germany. True water style manual lymph drainage, actual scientific manual lymph drainage, originated in Germany hundreds of years. They've been using it for hundreds of years. Yet now here, somewhere there was a miscommunication and it's been watered down and it's been unsafe, and now it's cheaply marketed in Miami for plastic surgery because it's the same thing as buying a $200 faja. Guys, our garments at most will be $100. At most. You should not be paying $200, $160, $190 for a garment. That is insane. That is a Miami markup, the same way lymph drainage in Miami is a Miami markup, unless they are actually doing true, gentle, hands-on lymph drainage. So, all of the whys about Miami. I hope this answers a little bit of some of your questions. I hope this was somewhat informative, and I hope I wasn't just ranting. And I just want to show you guys real quick, because she's been sitting here the whole time. This is Cleopatra, and she's been here the entire video. So, I hope you guys have a great day. I will see you guys later. And if you have questions, DM us, call us, set up a virtual consult with me. I will be happy to answer any questions you have. So you guys have a great day, and I will see you all very soon. Bye!